Hey y'all, today I'm going to talk to y'all about the social determinants of health. There are 5, but for my poster today, I decided that I wanted to talk to y'all a little bit more about the lack of access to healthcare. The title of my project is Healthcare for All, and I created a little slogan. It says quality care, equal access, and healthier communities. And by that, I just mean healthcare for everyone, regardless of your race, your gender, whether you make a lot of money, whether you make no money, just everyone. We all deserve it. Each of these determinants are social factors that are affecting the health of our community negatively. I say healthcare for everyone because I hear stories all the time about how people were refused care because they didn't have insurance. I know this might be seen as false because I got this example from a TV show. However, it can most definitely be a real life example. But in Grey's Anatomy, there was an episode all about this man and his daughter. He came over from Mexico and his daughter needed surgery, emergent surgery. And he couldn't afford it because he had no insurance. He was over here working and he just hadn't had the money to get insurance because all of his money was going back to the rest of his family in Mexico, and it was a whole ordeal, but they ended up getting her the surgery she needed. And then the rest of the episode was talking about how they needed a fund for the people like her who needed emergency surgeries like that, and for the uninsured families and people. And I think it's really important that we do have that because there are plenty of cases that end like that. I have the little picture of the homeless guy up there because those cases can be really sad as well, where they get sick or they can't afford to take their medications or go see the doctor, and will lose them to their illness because they couldn't afford the treatment. And that's really sad. I also read this article. It was written by this son about his father. He was a hardworking man. He had a wife, 2 kids. He barely made $40,000 a year. And it was easier for him to pretend that nothing was wrong with his health. He worked every day to provide for his family. He just needed to make money for them, but he was starting to notice things that were wrong. He didn't want to add on the stress of medical bills or the stress of an illness. And eventually he had a stroke, and it kind of put things into perspective because even I'm guilty about putting others first. But I hope that one day as a community we can teach people that we don't have to be afraid to go to the doctor, to seek treatment and to get help because we're scared about how much it's going to cost us. We need to know that it's okay to get help, that you just need to take care of yourself first. Don't worry about the money. We'll worry about that later. I hope to eventually have programs for that. And we just need to learn to put ourselves first, our health first. I hope one day that these issues are issues no more and the world becomes a better place. We need to do better. Our community needs to do better. And just be healthier.